Now, following the announcement on confirmed cases of coronavirus, the disease rather called COVID-19, by the Ministry of Health and the directive by His Excellency the President Uhuru Muigai Kenyatta on 15th March 2020, it has become necessary to take further precautionary measures to prevent the general public from possible infections. In exercise of the authority vested in the County Executive Committee, and in accordance with the provisions of the Public Health Act Cap 242, the laws of Kenya, the general public is notified of the following directives. Number one, that the county government has set up an isolation and quarantine facility at Mount Kenya Hospital, Nyeri. We have deployed medical personnel, actual number is 3, who previously served in Liberia Ebola crisis to the facility. Their expertise will be highly valuable in managing any possible outcome. The county government has equally prioritized procurement of hand sanitizing materials and personal protective equipment to be supplied to you for use within our hospital facilities, all of them. Residents are advised and encouraged to immediately contact the hospital on any suspected case of the COVID-19 within the county through the following contacts. Number one, 0800 72316, 0721 619 407, 0722 272 326, or 0758 563 121. These are numbers that will be active 24/7 and will be manned. In the event a patient exhibits the symptoms associated with COVID-19, we have provided a standby ambulance for transportation to our quarantine facility. What we are saying is that in the event of suspected case, kindly call the numbers and do not move the patient. All you can do is quarantine and call us to come for the patient. We are in partnership with the national government, the Kenya Red Cross Society, and private medical facilities to provide all the necessary care and support to our community. The county government has dispatched information officers and our public health team to sensitize the general public on COVID-19. In the days starting today, going ahead, you're going to be observing our loudspeaker mounted vehicles going around all over the towns, giving a pre-recorded message on how to avoid COVID-19. This will be going around. We're going to run it over the whole 1 week. We have also directed that all ECDE, all early childhood education centers, and our vocational training centers, 39 of them, are hereby directed to close down with immediate effect. Our learners are encouraged to continue studying from home until further notice. The county government has equally prioritized procurement of hand sanitizing materials and cleaning agents to be supplied for use within our markets, factories, and tea collection centers as soon as is practically possible. The general public, business community, and persons of goodwill who wish to support this initiative in the Nyeri spirit are encouraged to support this initiative by donating hand sanitizing materials to our Department of Social Services. We are encouraging those that are able to provide and donate during this time of crisis. In matters relating to public transport, public service vehicles, and all SACCOs operating within the sector are encouraged to provide hand disinfectants and always travel with well-aerated vehicles. In other words, we are saying we are encouraging the SACCOs to work with us to ensure that passengers get their hands sanitized and the vehicles are traveling with windows open, because we do not want our passengers in enclosed areas. The county government continues to discourage congregation of persons within entertainment joints. All bars and institutions selling alcoholic beverages being business regulated by the Nyeri County Alcoholic Drinks and Control Act are required to support public protection by providing sanitizing agents and to also take precautionary measures, including closing earlier than usual by 10 p.m. to limit contact entertainment and avoiding overcrowded situations. Our public health team will be on the ground to ensure that this is done. All businesses, offices, religious places of worship, and any other place where 5 or more persons may gather at any particular point are encouraged to provide hand sanitizing materials and cleaning agents to the general public during operating hours. All county government seminars and meetings that are not of an urgent nature are suspended with immediate effect for a period of 30 days. The respective department heads are required to liaise with the county secretary's office on staff that will be authorized to work from home. Members of the public are advised that the normal public appointments held in my office on Tuesday are now suspended until further notice, so that we can avoid the crowds that come to my office. In conclusion, members of the public need to be aware of the prevailing circumstances we are in and take personal initiative in protecting themselves and their families. These measures include avoiding body contacts and always ensuring we have hand sanitizers. And as Africans, let us reduce our handshaking. Let us nod to each other. Let us use our elbows. Let's do everything else to avoid this, the spread of this disease. If there should be anything we need to do as a county, as Nyeri, is to ensure that we have locked all our boundaries. And we want to urge the citizens, should you come across any person working, traveling abroad, kindly treat that person with suspicion. We know that in this county, we have a number of Chinese companies that are working here. We also would wish to request that those employees within those companies keep away from any of those people who may have traveled recently in the last 1 or 2 weeks that COVID has been around. Finally, I may be able to take a few questions. Yes. 15 million. We are going to spend about close to 15 million for the entire protection and preparation. Yes. Really, let us agree that in all these matters, COVID-19, we call upon the citizens to take it upon themselves to protect, because government cannot stop you from shaking hands. Government cannot stop you from hugging. Government cannot stop you from going to crowded places. We still insist that while our personnel will be on the ground and we will be going around in the markets and everywhere, sensitizing our people, we also require and request our people to take personal precaution, even in the slums, everywhere. And I think we must also understand, COVID-19 is not selective. It is touching presidents, it is touching wananchi wa kawaida, it will go to the slums. All of us are at risk. So the best thing is for all of us to be extra careful. With, yes, COVID is not transmitted through food. So there is no risk really bigger than what we are doing. Handshaking, selling of food. In other words, we are saying let everyone be careful, because what we are told by those that have information is that the COVID is a virus. The coronavirus has been with us. This is a new streak that will last in your throat for a number of hours before it has gone down and attacked the lungs. We are also told that it will land on surfaces and can last for up to 10 hours on a surface. So we are saying even something like this should have been sanitized. What we are using here should be sanitized. Everything. In other words, we are saying nobody is safe and nowhere is safe. So let's get that tradition of using sanitizers everywhere. And it is also important that people know that even basic hand washing is good enough. Basic hand washing. Let us wash hands as many times as possible. Yes, yes, yes. Yes, yes, yes. Thank you, Martin. Mount Kenya Hospital has a peculiar setup. We have compartments there other instead of wards, so we are able to isolate every patient within their own facility. So within the facility we have a bed occupancy of about 21. We have compartments, we have rooms and wards, and that is where we have put in the 3 personnel who I have said were involved in the Ebola fight in Liberia. They have that expertise. They know issues about isolation and quarantine. So that is why we have specifically looked for them. We have also continued to hold continuous training of our personnel, not only at Mount Kenya, but from every of our health centers, the 125 of them. The staff has been sensitized, and we are doing everything in our power to provide masks for them so that we may reduce the risk of infection. We have enough, I said we have enough. Remember, for corona or for COVID-19, the experts tell us there are no special drugs. It is the same drugs that we use to treat common colds and something. The issue is the velocity of the virus when it does attack us. Anything else? Thank you. Asanteni sana.